The Department of Psychological Medicine is one of the 18 departments in the Yong School of Medicine at National University of Singapore, where we provide undergrad education to more than 300 medical students a year to prepare them to become full-fledged doctors. Being located in a tertiary general hospital, the National University Hospital, we are able to look at patients' needs as well as clinical challenges with a multidisciplinary approach, both from clinical service development, clinical problem solving, as well as developing new intervention. At the same time, we are able to harness the experience to train next generation of doctors, psychiatrists, psychologists, nurses, and allied health professionals. We also have a program that looks at upstream prevention and program development to serve the mental well-being of the well population as well as the at-risk population. This is undertaken by the NUS Mind-Science Centre. The purpose is to help to build in our population, in our community, individual with an undefeated mind, from the young across the age continuum into adult as well as into elderly.
The focus of research in our department is in three areas. One, aging, second, mood disorders, and third, on child mental health. Aging psychiatry is doing very well, and now the focus is on dementia prevention. The Dementia Prevention Program is the first study in Asia on dementia prevention. The study is conducted amongst elderly people who are high risk of developing dementia. The protocol includes health education, art, music, mindfulness practice, and also exercise Tai Chi. We're now including gardening because we found that horticultural therapy is also something advantageous, helping the cognitive function. The research we've done for dementia prevention tells us that there's a possibility that we can prevent or delay the onset of dementia. The research is now translated to the community, and there's a glimmer of hope in terms of dementia prevention. The university research includes a team that is studying neuroelectrostimulation. They're also including study on ketamine as a form of antidepressant, and these are very new areas we're trying out in Asian countries. What we want to do in our research, and we hope you can also be collaborators to come and see what we're doing, is to do research which will promote mental health, destigmatize mental illness, and to improve the quality of life of people.
Our department takes care of patients across all different age groups and also across different settings, from the inpatient to the outpatient as well as to the community. For children and adolescents, we try to provide holistic treatment. We provide care in a multidisciplinary team. We work with psychologists, occupational therapists, art therapists, as well as sometimes we engage the help of life therapists to help children cope with life stresses. We have another specialized care for women who are actually in emotional distress. Particularly, we are looking at a perinatal period, that means before their pregnancy, during pregnancy and post-pregnancy. I also provide emotional care for women who are struggling through gynecological cancers as well. Our ASCAT program is for our general adult population. ASCAT stands for Assessment and Shared Care Team. It's a team that does community outreach whereby they go into the community to assess patients and help them to come to the hospital for their mental health needs. For elderly people, we do have specialized services as well. Geriatric stands for Geriatric Psychiatry, Outreach Assessment, Consultation and Enablement. We send doctors as well as case managers outside to the community to help assess the elderly in their own homes.
The Department of Psychological Medicine provides clinical training as well as research opportunities for our undergraduate students of the Yong School of Medicine. Our undergraduate medical education program is a 6 weeks education program that's specially catered for our Year 4 medical students who are posted to our department. During this period of time, students will be taught the necessary skills to diagnose and to manage common psychiatric disorders. We provide research opportunities for our residents as well to embark on research that may be of interest to them or get attached to experienced researchers. We do have avenues for interested parties to embark on master's and PhD programs. We host the NUS Academic Psychiatry Conference on a yearly basis, and we touch on important pertinent topics in psychiatry such as neuromodulation, child-adolescent depression, psycho-oncology. We will invite international speakers who are experts in their fields to share with us their expertise, and through this process, foster international collaboration in terms of research.
Singapore is a very open learning place where many things happen, and so we do have many opportunities and programs to welcome many of the learned scholars and clinicians to come here and collaborate with us, as well as to teach with us. We can learn from them, and similarly, they also could get a good insight and understanding of the unique ethnic and cultural aspect of psychiatry and how they could bring about a better emotional well-being of the people here as well as in this part of Asia.